VIPoos, welcome back to yet another episode of Party Pooper. On last week's vlog, I talked about depression and mood swings caused by living with Crohn's or colitis. This is just one of the many things that you're dealing with on a daily basis when living with a disease that actually doesn't have anything to do with the digestive system or pooping itself. Back when I first started the Party Pooper channel, my mom had suggested that I do a video on a topic that was really difficult for me to talk about, even more so than talking about my bowel movements. We're dealing with an autoimmune disease, so there are actually a lot of other things that can happen to a person when they have an autoimmune disease. You don't even necessarily have to have Crohn's or colitis for these things to happen, but they tend to go hand in hand. One of those things happens to be psoriasis. I didn't actually have psoriasis when I was first diagnosed with ulcerative colitis. It came about 6 or 7 months after, and it's very common that when you do have Crohn's or colitis that you will have this as well. If you don't know what psoriasis is, it's very similar to skin conditions like eczema, except for it tends to be a little bit more severe. What happens is because your body's attacking the healthy body tissue, your skin is trying to regrow too quickly, and it often looks red and flaky because the skin is peeling off. This can sometimes be uncomfortable, it can be itchy or painful, depending on where it is on your body, what type of psoriasis you have, and how severe it is. Because I'm on Remicade, which suppresses my immune system, I get sick very easily, and back in October I caught strep throat. For the strep throat, I was put on penicillin, and a couple of days after taking the penicillin, my entire body broke out in what looked like hives. I went to the emergency room. Sure enough, they told me it's probably an allergic reaction, we'll send you for an allergy test. I immediately stopped taking the penicillin, and days went by and the hives didn't go away, and then weeks went by and the hives didn't go away. And then by about 1 month, the hives started to change and look like what ended up being psoriasis. When I went to talk to my doctor about it, he said it didn't make sense that I would be covered head to toe in psoriasis because the medication I'm on, Remicade, is actually used to treat severe psoriasis. The only way to treat the psoriasis was to scale back on the Remicade, which therefore would make my colitis worse, so it was either psoriasis or colitis, and at this point, I was kind of already dealing with both. Because the hives had irritated my skin, my body reacted by breaking out into psoriasis. And by about the 3-month mark, this psoriasis had spread. So it was no longer just spots where the hives had been. Now it was full patches. Basically, my entire chest, stomach, and back was completely covered. You couldn't see clean skin. And then my arms and my legs were spotted, and my feet were also completely covered. If you look back on my first few videos, you might notice that I actually have white spots all over my arms and my chest. This is what happens when the psoriasis clears up. It actually leaves what almost looks like a scar, but it is not permanent. As you can see, it is gone now. Going back to when the psoriasis was covering about 80% of my body, this was obviously very uncomfortable, very embarrassing, and this is pretty much what caused me to be depressed. On top of having the disease and the bowel movements and the pain, I felt like I didn't want to go out into the world. I didn't want anyone to see me. I honestly felt like I looked like a monster. After seeing the dermatologist and then the dermatologist talking to my GI, both of them came to the conclusion that the best option was to scale back on my Remicade treatments to see if my body would have a reaction, because it seemed that the more Remicade I had, the worse the psoriasis actually got. Sure enough, this worked. I scaled back to 1 treatment every 8 weeks rather than every 4 weeks, and the psoriasis almost completely cleared up. I still do have it pretty severely on my feet, most likely because I'm always wearing shoes and walking on my feet, so the skin isn't able to heal properly. The strangest thing is that now when I go for Remicade treatments, my feet actually are a lot better for the first couple weeks after treatment, so it seems what caused the psoriasis is actually now doing what it was supposed to do in the first place, which is help the psoriasis. At this point, I've accepted that, like colitis, I will have psoriasis for the rest of my life. I don't know whether or not it'll come back and cover my entire body again. I don't know if it'll ever clear up on my feet, but it just goes to show that Crohn's and colitis isn't necessarily always invisible. There are, however, many different ways to attempt treating psoriasis, and they come in all shapes and sizes, costing you a pretty penny regardless of whether or not you have benefits. As I said before, the one place that my psoriasis hasn't cleared up is on my feet, and it's actually pretty severe, which makes it difficult for me to go to the beach or to the pool because I worry that people are looking at me like I have a disease. I promise you it is not contagious, it's just not very pretty to look at. I kind of thought about doing this video because I recently saw my dermatologist and they talked about putting me on a drug called methotrexate. They described methotrexate to me as being like a baby-sized dose of chemo. They said about 5% of people would feel nauseous, 5% of people on it would possibly lose their hair. Well, I already lost a bunch of my hair because I had psoriasis in it so badly that when the chunks fell out, it actually ripped my hair out of my head. It also said that it can be very damaging to the liver, meaning if you're on this drug, you're absolutely not to drink alcohol at all. I know what you're probably thinking, hey Sherilyn, you have a chronic illness, maybe you shouldn't be drinking alcohol at all. I've given up coffee, tomatoes, onions, and the ability to make it through a movie without having to go to the bathroom. I'm not giving up my weekend drinks. I will say though, if you're obviously really sick, don't drink. Like, I went months without drinking when I was really sick. Like, come on, I'm not stupid. The other issue with methotrexate is if you're a female and you're looking to become pregnant, this can be very damaging to your fetus. Therefore, they will not allow you to be on it. And when you are on it, you have to go for regular blood tests to check the liver so they will know if you drink when you're on it, as well as regular pregnancy tests to make sure that you're not pregnant. After discussing all of the side effects and concerns that go hand in hand with methotrexate, I decided to take some time and think about whether or not I wanted to be on this drug. Do I really care that much about the psoriasis on my feet? Is it really that ugly or that bad? I mean, I think it's a very personal thing. Like I said, when I had it all over my entire body, I literally felt like a monster and was mortified. I didn't want anyone to see me. I even struggled talking to people about it, telling them, you know, when they would see it on my arms, what it was. I think that if it came back as severe as it was last winter, I would consider going on the methotrexate. But for now, I'm gonna stick to all of these creams and hope that one of them works. I'm not only doing this vlog to tell you about my experience with psoriasis, I'm actually doing it because I want to know what your advice is. I'm sure if you're living with Crohn's or colitis, there's a good chance that you might have psoriasis as well. And like I said, I've tried a million creams, and I also want to know, how do you feel about living with psoriasis? Do the people in your life really care that much? Do you really care that much? For me, when I first had psoriasis, obviously it was a pretty severe case and it was really hard on me. And even at this point, I still get embarrassed and hide my feet sometimes. I'm not only asking you for your advice for the other viewers this week, I'm asking for advice for myself. If you have any advice on how I can fix this, home remedies, whatever you got, I am open to trying it. I would show you guys, but like I said, I'm honestly pretty insecure about it, and you don't want to see my ugly feet. I mean, like, they're not like ugly, but you know, they're feet. So once again, please share your comments and advice below, and if you like this video and the style of videos I've done the last couple of weeks, please give it a thumbs up and I will keep doing more. And as always, thank you so much for watching, and I'll see you next week. VIPs. Bawling my eyes out. Snapping on people. I hate you, you're ruining my life.